Hi, Vineet.
Yeah, I am from Mumbai. Just wanted to have key mean it is being told that key fasting is itself is the one of the best medicine for curing your body, in fact.
Yes.
So, but at the same time, you have to have take medicines.
Huh.
Like say, for example, your blood sugar medicines prescribed by allopathic doctors and all.
Yes.
During fasting, how these medicines need to be managed, like.
Well, so what happens is that once you're fasting, your body will start taking or also releasing your own stored, glucose or fat is being converted into glucose, and that is what is being managed.
Yeah.
On top of that, once you add other more medications, you are going to reduce even more further, and this might end up in a situation where we call as hypoglycemia. This might come. It is not that it will come, but it might come if your body is not able to withstand that medication and also the fasting.
Okay.
Fasting in itself is a healing process that is going on. On that above, we are again putting a synthesized healing process through the medication, which is going to drastically reduce your blood sugar level. That is also going to be a very problematic issue. So make sure that while you fast, medications in the night will also trouble you in frequent urination. This is also one of the reason. Anyone who is taking medications or metformin or any kind of things, if you are seeing that there is an increased frequent urination while you are taking the medication in the night and in between the 3 or 4 o'clock or in between 2 to 4 o'clock, if you are getting frequent urination, this is because of the built-up of excess amount of glucose in your body that is crossing the threshold level, as I spoke, 180 mg per dl, and that is going to cause a lot of problem. So try not to go to that spectrum where you will be hypoglycemic. Hyperglycemic, that is increased blood sugar level, can be managed. Hypoglycemia can even lead up to people going to coma, or they are not able to do, and especially while you are sleeping, that is most dangerous because you are not aware of how your body is responding. When you're awake, at least you know that you're sweating, you're craving some food, you will immediately go and take a piece of chocolate or anything xyz. But while you are sleep, you will not get to know, and you will slip into the coma or any other health complications. Hypoglycemia is very dangerous. Please try to avoid that.
So
uh,
is it better to during the fast to avoid medicine?
yes, try and see. Above all, try and see above
Okay.
that also, if you need medication next or next day, then if it is necessary, then you take the medication.
Okay.
So it is your body, you need to just experiment or take a half a tablet.
Okay.
Don't just remove that. Take half tablet. How does your body respond? Take that. Understand that. So
Okay.
if it is taking well and good, if you are able to manage, then reduce the half also. Then see without the medicine how it is going on. If it
Okay.
is that able to manage, then well and good. Continue further.
That's great. And second part, you said that milk need to be whatever milk. So there is no milk intake. Whatever milk which is going, say for example, in tea. So
Huh.
we usually have two times tea, one in the morning and then one in the evening, and
Yes.
that half a cup of tea.
Huh.
Is that with that tea without milk is better, or obviously,
Yes. Without milk and the without the milk and the tea.
so
That is
tea
going
without
to be,
milk?
yeah, without milk and without the sugar also.
Okay, got it.
That would be fantastic, because the reason why tea became popular in India is because it helped a Chinese guy increase his lifespan, because this was an antioxidant in nature. Now we made it more pleasurable in India by adding milk and sugar. We enhanced its
The
capabilities
taste.
to
Hmm.
savor our tongue, not our health. So
True.
back in the days, it was, were drinking because of their health, to improve their health, to improve their lifespan. Today, the same milk, the same tea, and the same sugar, that is reducing our lifespan and leading us to be diabetic or lifestyle disease and reducing our lifespan. So
Okay,
just by drinking that black tea, what they people say, that is going to be beneficial for you.
got it.
Just
Got
like how they did it in old days.
Got it. So these were the two major queries. Rest of the things, as per dietitian, as you suggested, ki, you should have a professional dietitian to guide you for the medicine. And I'm trying doing that by taking salads prior to lunch and dinner, and also by doing at least 1 hour of walk a day.
Great, great. You're in the right direction. You know, I know my patients, because most everyone knows the answer. Then you know the answer. Certain small things, it's just that things to be put in direction, and you will be fine.
Thank you, doctor. Thank you very much.
You're welcome.
Diabetes Reversal Launchpad. Mission to educate and empower 10 lakhs plus diabetics by 2025 with knowledge to deal with diabetes in a better way. Master the art of managing and reversing diabetes with hand-holding support in 3 hours live webinar, and break the chain of lifelong medication with self-discipline. Register now and reserve your spot for upcoming session.